Welcome back, our fans. Surgical infections. Pathogenesis. Infectious agents. Endogenous, skin, gut or sinuses. Exogenous. Host reactions. Nonspecific immunity. Specific immunity, cell-mediated and humoral-mediated. Closed unperfused space. Bacteriology. Gram plus Vacocci. Staphylococci. Streptococci. Aerobic Gram-V bacilli. Escherichia coli, E. coli. Klebsiella. Pseudomonas aeruginosa, Piocyanea. Proteus vulgaris. Anaerobic bacteria. Peptostreptococci and bacteroids. Complications. Spread. Direct. Lymphatics. Blood. Fistula and sinus. Gangrene. Non-healing of wounds collagenase. Immunosuppression and sepsis. Diagnosis. Clinical presentation. Signs of inflammation. Draining elements. Constitutional manifestation. Laboratory. CBC. Culture and sensitivity. Markers of sepsis. Radiological. X-ray. Sonography. CT and MRI. Invasive, ERCP. Treatment. Incision and drainage. Excision. Antibiotics. Supportive TTT. TTT of sepsis. Surgical site infections. SSI, third most frequently reported nosocomial infection. 14% to 16% all nosocomial infections in hospitalized patients. SSI includes all infections related to the incision at any depth. Occurs within 30 days after surgery, when there is purulent drainage from the incision or growth on culture of material from the surgical site. Definition: SSI. Superficial, 2/3 are superficial, which involve the skin and subcutaneous tissue above most proximal fascia layer. Deep infections involve fascia, muscle, tissues regardless of skin or subcutaneous involvement. Risk SSI according to degree. Bacterial contamination. 1 clean operations, 5%. In which no inflammation, the respiratory, alimentary, genitourinary tracts not entered, no break in aseptic operating technique. 2 clean contaminated operations, 10%. The respiratory, alimentary, genitourinary tracts entered but no significant spillage. 3 contaminated operations, 15%. Acute inflammation, no pus/visible contamination of the wound, i.e. gross spillage from a hollow viscus during the operation. Open injuries operated on in 4 hours. 4 dirty operations, 30%. Plus pus, previously perforated hollow viscus, open injuries greater than 4 hours old. Microbiology and prophylaxis. 1 most common pathogens: Gram plus bacteria, i.e. Staph aureus, Enterococcus. 2 perioperative antibiotics give to reduce microbial contamination in the incision and prevent SSI. 3 prophylaxis recommended for clean operation with graft of prosthetic place, for all clean contaminated operations. 4 exception, laparoscopic cholecystectomy, which is considered a clean case. Diagnosis: SNS. Fever. Swelling. Erythema. Localized pain. Incision tenderness. Leukocystosis variable. Most infections are superficial and uncomplicated. Treatment: skin and SC and involved area opened, underlying fascia. Examined for dehiscence. Gram stain any purulent. Drainage. Debridement necrotic tissue. Antibiotics only for complicated infections or patient high risk for dissemination of infection, i.e. diabetics, immunocompromised. Cellulitis. Non-suppurative. Inf. of SC tissues. Causative agents. 1. B. Hemolyticum strept. 2. Staph. 3. C. Perforin. Erysipelas. Non-suppurative inf. of lymphatics. Highly contagious. Causative agents. Hemolytic streptococci. Complications. Gangrene. Lymph obstruction, elephantiasis. Cavernous sinus thrombosis. Furuncle and carbuncle. Staphylococcus infectant of hair follicle or a sebaceous gland. Hidradenitis suppurativa. Mixed staph. And streptococcal infection of apocrine sweat glands. Abscess. Coagulase plus V. Staphylococcus aureus. All features of inflammation plus 1. Indurations. 2. Fluctuation. 3. Pointing. Plus constitutional general features. Clostridia infections. C. Perfringens, gas gangrene, food poisoning. C. Tetany, tetanus. C. Botulinum, botulism. C. Difficile, pseudomembranous colitis. Tetanus. Caused by Clostridium tetani gram-positive spore-forming anaerobic rot. Spores of C. tetani are found in soils throughout the world. Spores are very resistant to hard conditions: heat, radiation, chemicals, drying. Spores can survive for a long time in environment, 100 years possibly. Pathogenesis. As growing cells of C. tetani produce tetanospasmin at the wound site, the toxin starts to migrate along nerves into the central nervous system, where it blocks the release of inhibitory neurotransmitters. Sequence of events: tonic stage, locked jaw, stiff neck, difficulty swallowing, muscle rigidity, spasms, clonic stage. The contractions by the muscles of the back and extremities may become so violent and strong that bone fractures may occur. Types of tetanus: traumatic, puerperal, otogenic, idiopathic. Tetanus neonatorum. Treatment of tetanus: very difficult to treat once symptoms have developed. Antitoxin is administered. Muscle relaxants. Supportive therapy, ventilator. Cleansing of the wound. Diazepam, Valium, most commonly used drug for treatment of tetanic spasms and tetanic seizures. Depresses all levels of CNS, including limbic and reticular formation, possibly by increasing activity of GABA, a major inhibitory neurotransmitter. Tetanus immune globulins. Metronidazole, Flagyl, active against various anaerobic bacteria and protozoa. Penicillin G10 40 million units/day. Thanks for watching. Support us by likes and subscribes.